Hi there, and welcome to this video. I am Dr. Surinder Sandhu, Doctor of Chiropractic from Bedford Chiropractic Clinic and the owner of Bedford Chiropractic Clinic as well. And today in this short video, what I want to do is I want to talk to you about a problem that has probably brought you to this video, which is shoulder pain. Shoulder pain, shoulder range of movement restriction, shoulder instability. And I'm here to help you understand what might be causing it and also assure you that here at Bedford Chiropractic Clinic, I can potentially help you. With over 25 years of experience, I am the most experienced chiropractor in Bedfordshire. I've treated well over 30,000 patients and completed well over 130,000 plus adjustments on my wonderful patients. So today I want to talk to you about shoulder pain and shoulder problems. Now the shoulder is an incredible joint. It is designed for mobility, and unfortunately it has a lot of muscles that are connected around the shoulder joint to allow us to have that mobility. I say unfortunately because that means then potentially there are a lot of problems that can arise. The shoulder itself attaches to our skeleton just through this one joint here, which is the clavicle. The rest of the joint is actually floating on muscles attached to the ribs. The shoulder joint itself has what we call the rotator cuff, which are sort of 6 muscles called the sits muscles that actually sort of hold that joint onto that chromium there, onto the glenohumeral joint there. Now, the shoulder problem may have been caused by a problem that you might have experienced in the past, an injury either to the wrist, the hand, or the elbow, because please understand that this is called the kinematic chain. If you have done something, if you've injured and landed on your wrist, damaged the wrist, or you've damaged the elbow, that has and will have an effect on your shoulder. It's numerous times that I have treated patients over the 25 years who have come in with a shoulder problem, and it all originated from an injury they had maybe 5, 10, 15, even 20 years ago, where they fractured a wrist or they damaged their elbow. And unfortunately at that time, as even now regrettably, when you go and see somebody at the hospital, they're going to focus on their injury that they can see, which may be the wrist, which may be the elbow. So we're going to be examining all of that to get to the bottom of why you've got the shoulder problem. The shoulder problem might be that you've just had a recent fall, right, on your arm. It might be the fact that you've slept awkwardly. You've slept with your arm in an awkward position. It might be that it's a sporting injury, right? You're doing some sport, you're playing tennis, or you've lifted some weight up incorrectly. So it could be a sporting injury as well. It might be that some kind of other trauma has affected the joint, strained the muscles, strained the joint. Please don't wait. Don't rely on painkillers. Painkillers never fix anything. All they do is dull your brain from the actual underlying symptom and don't fix anything. But I am actually here to help you understand why you've got the problem, what's causing the problem, and then to actually help you to fix it by helping you adjust your posture, because it might even be that it's a simple thing, like the fact that what you are doing is that you are standing in an awkward position all day long, and that is creating a rounded shoulder problem where you're rounding your shoulders all day long. It might be that you're just overtraining these muscles in the gym. Or it could be the fact that you're working on a computer all day long with your shoulders hunched and your head forward, and that might also be causing the problem. But I assure you that we will get to the bottom of it. We'll work it out, because it's no good me just loosening you up, treating it, making it feel better for a few hours, a couple of days. We really need to understand why you're doing it, what's creating the problem, and then help you fix it. And that is why I think the Bedford Chiropractic Clinic and what I do is the best chiropractic service that you're ever going to get here in Bedfordshire or anywhere, because I am committed to getting to the underlying cause of your problem. So what else could be causing it? It could be a strain. It could be that you have done some gardening. It could be that you've done some painting, but you've overused the shoulder. It might even be that you have got a neck problem, because if you look at this diagram here, you can see that the neck here is connected to the shoulder by this beautiful network of nerves called the brachial plexus, And these nerves are what control all these muscles, as these nerves control every single muscle in your body. So if you have a neck trauma, a neck problem, neck stiffness, neck ache, then that could be shutting off the nerves to your shoulder muscles. And just last week, we had a gentleman who is in his 70s. He loves playing golf and recently was really struggling to play golf and enjoy the one thing that he loves doing now. And when I examined him, the lack of range of movement in his shoulder, the pain in his shoulder wasn't related to the shoulder as much as it was to a neck stiffness, a neck problem here, because that neck stiffness was causing a problem with the nerve supply to the shoulder muscles, and that was what was causing the weakness and the pain in his shoulder. And surprise, surprise, when I treated his neck, the shoulder, he got the range of movement back and the pain went. And he came back just a couple of days ago, really happy that he could play golf and not hurt anymore. So, how do I treat it? Well, what we do is we'll examine every single muscle in your shoulder, we'll muscle test it, we'll find out what's going on, we'll also examine obviously everything else, we'll examine your neck and your shoulder, and then we'll treat it. And yes, chiropractic is a treatment by hand, and you may have seen some videos on YouTube that, chiropractors treating things, and you may be put off because it's a little bit forceful. Well, please rest assured that the way that I treat is a method called Activator, where what I'll be doing is I'll actually be treating you using this beautiful tool here, which is it's pain. I'm not going to say it's painless, but definitely it's not as forceful as me adjusting your neck or or any kind of other joint. Okay, so it's a very gentle form of treatment. It's what I personally prefer, having done on myself as well. So if you have a shoulder problem, give us a call today. In the meantime, one of the things you might want to do is just have a look at my website, bedford-chiropractor.co.uk, and have a look at some exercises. If you're on the website already, it's under recommended exercises, it's on the tab up there. Have a look at those. They're going to help you just to relieve some of the tension that is causing the muscle spasm around your shoulder joint. But obviously, come and see me as well and let me help you fix the problem. So give us a call today, and I promise to either see you today or certainly as soon as possible, but you need to call that number. The number is right there, and let me help you resolve and fix your shoulder problem. Don't just put up with it. Dr. Sandhu, Bedford Chiropractic Clinic, the most experienced chiropractor in Bedfordshire, here to help you, Bedfordshire community, with any shoulder problems that you may have.